looking at the muscles that adduct and abduct the hip and the thigh, the gracilis and the tensor fasciae latae will insert on the tibia but still act on the thigh. The adductors will all insert on the femur. All of them will originate on the os coxa. So when we isolate them, looking to the medial group, we can see the adductors. And I'm just highlighting the bones to sort of give you an idea of where we are. And then there is the tensor fasciae latae, and we can see it connect from the os coxa to the tibia. Looking more closely, we can see the gracilis is the medialmost and largest of the adductors. Anterior is the longest, posterior is the magnus. And you can see they both connect to the os coxa in different locations for their origin and insert on the femur. Underneath the gracilis is the adductor brevis. And usually to see it, you will need to remove the gracilis. There's just that tiny little corner we're sort of able to see here. So they are the medialmost, and you can use them as landmarks. Working from anterior to posterior, we started with the longest, gracilis, and then the magnus. Looking at the lateral aspect, we see the tensor fasciae latae, which originates on the os coxa and inserts on the tibia. So adding in to see both legs, and the tensor fasciae latae happens to have no connective tissue, so that's why it looks different. We're able to see the gracilis and how the magnus is posterior to the gracilis. Like I said, use that gracilis as a landmark. No longer isolating the adductors and abductors. Use some other structures to help you find your place when needed to. Could you identify these muscles if they are marked from the anterior view? So this is a medial view. Could you identify these muscles? Use the sartorius, the patella, or the foot to help you with anterior and posterior. Would you be able to identify this muscle? Again, use the patella and the foot to your advantage when identifying anterior and posterior. So this is a lateral view. One more time through, would you be able to identify these marked muscles? Medial view. And a lateral view. One more time with the answers. Again, use some structures that you can find to help you with anterior and posterior.